Hi, this is Dr. Director Hassan, practicing reproductive endocrinologist and infertility specialist here in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. Here today with Dr. Naira Krypak, a dentist here in the Dallas-Fort Worth area. Dr. Krypak, welcome to the show.
Thank you so much for having me today here.
Absolutely. Well, first of all, tell our listeners a little bit about yourself and your practice.
Well, I've been practicing dentistry for about 10 years now. I graduated from University of Pacific in San Francisco. And in 2011, me and my husband, who's also a dentist, we moved to the Dallas-Fort Worth area. And just 3 years ago, we opened our own office in Frisco and have been in private practice since then. We have 2 young boys and just been busy.
Oh, fantastic. That's amazing. And so you practice general family dentistry. Can you tell us a little bit about why is dental health so important?
Yes, I do practice general as well as family dentistry. So I see a lot of kids and I see a lot of women in those childbearing, age groups. It is really important to understand the connection between oral health and systemic health. You know, our mouth is part of the oral facial complex, which is part of our body. And as healthcare professionals, we know that, any infection or inflammation in one part of the body can affect other systems as well. So it's the same connection, with the mouth. Any periodontal disease or poor oral health can lead to, catastrophic systemic effects. And there's so much research and information out there linking periodontal disease to, for example, cardiovascular disorders. A lot of the bacteria that are present in periodontal disease are also present in infected heart valves. So, if you've been to a cardiologist, you'll often notice that in their questionnaire, they also have a question regarding your dental hygiene. When was your last dental checkup or cleaning or visit? Because there are established evidences that, establishing a connection between the two. Also, a lot of other disorders, for example, sleep apnea, which is one of the leading cause of stroke. You can detect it because when, I look in the patient's mouth and I'm like, this patient could be suffering from obstructive sleep apnea. So many times I have to send patients for further evaluations for different cancers, syndromes, mineral deficiencies, you name it. So, it's beyond teeth and gums. We have to look at the systemic effects as well. And, who doesn't dread a tooth pain or a toothache? Besides that, it definitely has some systemic effects also. And a lot of diseases have oral manifestations. So, many times, we are able to see that and we send the patients for further evaluation. So it's very important to see your dentist on a regular basis and seek dental health care.
Wonderful. And you mentioned pregnancy and pregnant women. And I see a lot of women who come to me looking to get pregnant, and I help them conceive through fertility treatments. And they stay with me for the first couple of months of pregnancy. Tell us a little bit about pregnancy and dental health.
Well, pregnancy, even though it's not a disease, but it's an altered physiological, state that the body is in. So there are a lot of changes happening in the body, which can have, oral manifestations. So whenever I'm talking to my patients who are planning on getting pregnant or who are pregnant, I always, try to educate them on 3 important aspects. One is, what are the oral manifestations of pregnancy, or, what effects can pregnancy have in my mouth? The second one is there a connection between good oral health and fetal health? So that's one aspect. The second is, needing extensive dental treatment while you're pregnant. That's another important issue that I always discuss with my pregnant patients. The third is, is more educational geared towards the newborn and what to look for, once the baby is here. Now, coming back to the first aspect, which is, what changes can occur in my mouth from pregnancy, the most common being bleeding gums. Uh, the hormonal levels in pregnancy change, and certain hormones such as progesterone and estrogen get elevated. And the effects of these elevated hormones make the gums hypersensitive. You may experience localized tumor-like swellings in your gums, which is called pyogenic granuloma. It's another common occurrence during pregnancy. You may experience hypersensitive gums. You may experience bleeding gums on flossing, brushing, or just while eating. So, these are, again, exaggerated response of the gum tissue to the elevated hormones, and they just get exacerbated if there's any plaque. So it is really important to have a clean mouth during pregnancy. I personally, when I have 2 kids, and when I was pregnant, I had to have my dental cleaning every 3 months because my gums were very, very sensitive to plaque. And every time I had a little bit of plaque in my mouth, I would, my gums would start bleeding. So that's a discussion, for your dentist to have with you, and together with your dentist, they're going to come up with a hygiene plan for you to kind of discuss, if you need to come in even more frequently for your dental cleaning than, what you were used to. Another thing that I usually notice in my pregnant patients is, those who have a lot of morning sickness, the oral hygiene, takes a back seat because, early in the morning when you're suffering, toothbrush is the last thing you want to put in your mouth. So oral hygiene definitely gets affected, and we see a lot of, bacterial buildup and calculus and mineralized things, more built up in such patients. So again, such patients, we tend to see them a little bit more frequently. Acid reflux, again, a lot of patients, despite medications, suffer from acid reflux, and that can have devastating effects on teeth. Many times, despite medications, if it's not controlled, we have to make appliances for patients to cover their teeth because the acid can be very damaging to teeth and make teeth prone to decay. So those are some changes that can occur in your mouth while you're during your pregnancy. The connection between oral health and fetal health is again a big one. There's a lot of studies and research that shows periodontal disease is connected to, for example, low birth weight in newborns, preterm labor, preeclampsia, amniotic infections. So there's enough evidence, to make it one of the most important to-do list, when you're deciding to get pregnant or even during pregnancy. The other aspect that I often discuss with my patients is delaying dental treatment and then needing extensive dental work while you're pregnant. I have been practicing dentistry for about 10 years, and I have done a lot of complicated procedures, but I think the most difficult procedure that I've had to do was on 39-week pregnant female. I had to do a root canal on a molar. And you can imagine, you're 39 weeks pregnant and you have to stay reclined in a supine position for a couple of hours with your mouth open, with, all sorts of things in your mouth. It's not going to be fun. So that's another, one thing to consider, make sure everything is healthy. Just like, if we have high blood pressure, we would want our blood pressure to be under control during pregnancy, or if they're overweight. We work on all those things. We take our prenatals. So seeking dental care, especially preventive dental care before pregnancy or even during pregnancy is vital because, it just increases your odds of having a healthy pregnancy. It just increases your odds. I think, and the third aspect that I often discuss with my patients is, once the baby is here, what to expect and what to look for. Sometimes, people struggle with breastfeeding because of latching issues. Then I already inform the patients that, look out for tongue ties, and some babies are even born with, a few teeth in their mouth that affects breastfeeding. So, I think educating pregnant women both to make good choices for, themselves as well as the baby is really critical. And, all we can do is, empower women to make good choices. and hope they have a healthy pregnancy.
That's fantastic information. And I'm sure my listeners enjoyed learning a lot about dental health and pregnancy. For those of my listeners who want to learn more about you, how can they reach you?
Well, the physical location of my office is in Frisco, but people can reach us through our website, which is plushdentistry.com. We're also on Instagram by the same name, and we also have a Facebook page by Plush Dentistry. If they have any specific questions, concerns, they can also email me at drk@plushdental.com, which is drk@plushdental.com, and I'll be more than happy to help in any way.
Thank you for joining us today on the show.
Thank you so much for having me. It was a pleasure.
Thank you. Bye-bye.
Bye.